Good morning. So I am Michael Ray Pascual. So today I'm gonna talk about evidence-based practice. So what is the common misconception regarding evidence-based practice? So usually when selecting a treatment for a client or even to my students, many occupational therapists, including myself, simply used to consider only the public research. However, I believe that there are three components and the other two are frequently overlooked. So, what is my definition of evidence based practice? So, evidence based practice usually requires the integration of the best research evidence uh, with collaboration with your clinical expertise and our patients' unique values and circumstances. So, with that, clinical expertise or expert opinion is usually involved in EBP. So our knowledge, judgment, and critical thinking skills are obtained through our professional training and experiences. And next is the external and internal evidences. So the best available knowledge acquired from the scientific literature or journal is the external evidence, and from the client-specific information or the data collected from the clients and observation are also considered the internal evidence. And lastly, the client or student or caregiver perspectives. So the unique set of personal and cultural circumstances, values and priorities and expectations identified by your client and their caregivers are also one of the important factors in EBP. So as an occupational therapist, I believe that when all three components of EBP are considered together, um, clinicians can make informed, evidence-based decisions and provide high-quality services reflecting the interests, values, needs, and choices of our clients. So in this slide, I added some major steps of how we practice the evidence-based approach. So there are some misinformation about EBP. So as an occupational therapist working in school system, so I met a lot of professionals who promote a certain diet, which they claim that they provide more effectivity in terms of improvements of the client. And as an occupational therapist myself, is like there are a lot of websites, including Pinterest, Tools to Grow, which offers a lot of like worksheets or activities that we can use at school. So in that way, I believe that it's like before using these activities from these websites, we should be more careful about, we should always think about what is the best practice in terms of our students' development. So, so these are the references, and thank you for listening.